Hello, happy Wednesday Wellness, everybody.
2 Wednesdays in a row.
Look at us.
Maybe 3 Wednesdays in a row.
I think we're at 3, maybe.
Yeah.
Yep.
Really good for us.
We've been recording machines because we've got a lot of important things to tell you about.
Yes. And today we're going to talk about why babies get colic.
Yeah, we're going to talk about colic, about that like discomfort, crying all the time, super in pain, baby. It's heartbreaking.
Yeah, it's a pretty common thing we see in the office.
Yeah.
Why parents show up with a baby that, like constant crying, can't get comfortable.
Yeah.
They can tell like their belly's uncomfortable.
Yeah, usually really gassy, lots of like arching, the balled up fists, just like poor babies.
Yeah, I mean, if you've seen a baby with colic or you've had a baby with colic, you know what it is and how hard it is on baby and mom and dad. It's hard when you can't help your kid out, when you're trying everything.
Exactly. And
Console them.
that's one of like, I would say that's one of the like major reasons that we see some like younger infants, if we didn't see mom during their pregnancy, that's usually like big reason to bring your kid to a chiropractor, which is like good that they're like know that and coming in to see us and stuff, but it's tough. And so we just want to talk about like why colic happens,
right?
What is kind of happening with that too, and like what that tension is doing to their nervous system, and vice versa, right? What the nervous system's doing to that tension too. So when you come in, we obviously sit down with mom and talk about like history. It's probably like, okay, we don't think this baby has a long history because it's a baby, right? Right. Yeah.
But we usually see like 2 common-ish things about maybe like where the stress is coming from. Yeah. And it's usually like high stress pregnancy or just like stressful pregnancy or high risk pregnancy for mom. And
then usually stressful birth too.
Stressful birth, like, which we talk about all the time.
Birth trauma or vacuums, forceps extraction, cesarean. Usually it's a lot of like tension, twisting in the neck, and we're gonna tell you why that relates to.
So there's usually like some physical injury, not like, oh my gosh, brachial injury, right? But like hard on baby, like there's usually a long C-section sometimes is because like long labor, long pushing went into C-section, right? So that's long. But lots of tension on the neck,
in a weird position in the pelvis, like and that. And
it injures those muscles and nerves up there that control like the latching, so it makes feeding difficult.
Right, exactly. I'm glad you brought up the brachial plexus injury, because like that's something that's kind of common during pregnancy that most people like think about, like, oh, there's lots of traction on the shoulder that can injure the arm. But like we're talking about just traction in the neck, even just a normal birth, like there's lots of traction happening in the neck, and that can cause all sorts of things. That's the most common thing that we see with births. Honestly,
and
because it's so common and
and
affects
like
a lot of things.
Yeah, and the vagus nerve is up there, so like that's controlling like the latching, the sleeping, the digesting the food. Right, baby can't do any of that.
And like swallowing. All the muscles in the throat are innervated. So
then we get the gas and the reflux, everything. So so that's what we see. So usually that's a pretty common history we'll see in those babies.
Yes.
With colic.
Yeah, those are kind of the 2 main things. Like that's what's gonna cause those things. And so then we get
both of those stress, like the stress in pregnancy or the stress of birth, is really gonna push that nervous system in fight or flight.
Exactly.
Right.
So that fight or flight creates a place that's going to take away from like that digestion, the sleep, like you said, recovery, growth, all of the milestones. Like all of, and it just kind of becomes this like this snowball that just keeps going. But that's also going to impact, like, because of that lowered vagus nerve, that lowered parasympathetic, we're not getting digestive motility, so these babies aren't digesting their food well, so they get really gassy, they get colicky or like refluxy. A lot of times they have a hard time pooping, they get constipated and stuff, and then we just get like the tight tummy, really uncomfortable.
And you know, and the arching.
Arching. And that's part of like the tension in the nervous system too, and in the spinal system, is because of that traction, then all their muscles tighten up, and so then they're trying to release that. Just like when your neck hurts, you're like stretching it out and stuff like that. Babies are doing that too, trying to.
And babies shouldn't be doing that. Babies should just be real floppy, and they shouldn't be able to hold their head up right after birth. Even a few weeks after birth, you shouldn't be like, my baby's so strong they hold their head up. That's usually okay, there is some tension in that baby,
in that neurospinal system,
neurospinal system. So that's like, okay, no, like you want that baby laying like this.
They're brand new to the world.
Okay, when I'm gonna get this question, right? Like, well, what about like dairy intolerances? Because that's I'd say common enough people are thinking that first. Like, okay, baby's really upset. They're angry after eating. I'm going to give up dairy. Yeah. Right. And that helps sometimes. Like, yeah, dairy can be hard on baby, but it's not really taking care of the issue it's causing everything. Right. Exactly. Which is usually, again, like that stagnated digestive system. We're not like breaking down the food the way that they should be able to. And then the other thing is too, like the tongue ties and stuff like that too. Yeah, so maybe like getting those assessed, which is great, and they've already got those maybe revised. And you will usually see, like I say, a decrease in tension, right? And baby is usually going to probably eat better, right? But there's still things going on. Yes. It doesn't, again, take care of that underlying issue of like why those tissues were so tense and taut to begin with. A lot of it is the neuro-oral motor control. There it is. Gotta get all my words in order. Neuro-oral motor control. So like that's, you know, the muscles of the tongue, of the cheeks, of, you know, being able to swallow, move food around, latch, like all of those things are all innervated by nerves that go back into the brain. And so a lot of times, again, because of position that baby's in, because of the birth process, that can affect like the tone of the muscles in the jaw, the tongue, like all of those things. So like, yes, it may be like dense tissue that needs to be like surgically revised. Yes. To especially help like with like the tongue moving so baby can feed. Like, right, that's important. We're not denying also that. Like that neuromotor stuff is super important. And so getting those babies in for chiropractic care or craniosacral therapy or other things like that, OT, can all help with the underlying cause too. So then when those issues are released, then everything else is they have to learn to suck again and everything. Exactly. So like yes, like the ties probably are not causing the colic. It's can be part of it all, right? But and like I said, I think it's important to get that work done if you want to. They're all pieces of a puzzle, but the cool thing about what we do with chiropractic is it addresses all of it. Yeah, and usually we're the last puzzle piece people are coming to, but it'd be great if you're your first puzzle piece, because it makes all those other... We're actually the frame of the puzzle. There you go. Yeah. The frame! Everyone wants those edge pieces first. That's actually what we are. Because like, removing that stress, removing that subluxation, getting baby out of fight or flight, then every other therapy you do is going to function so much better. Exactly. They're going to heal faster from that surgery. They're going to be able to digest their food, get less gassy. All of those things are going to then fall into place a lot easier. Yep. Cool. So if your baby has colic, I'm sorry, because that's not fun at all. It's hard. It's really hard. When you're watching this video at 4 a.m., right, text us. We won't answer right then, but we will get back to you the next time. We will, yes. And so, new patient appointment, I believe this week when you watch this, we're actually doing a drive. Yeah, we're doing back to school drive. Yeah, so you get, if you bring in school supplies, they're going to Grand Rapids Public Schools, you get your exam for $50. So it'd be a great time to get in. Also, if you're like, oh man, my baby had colic, but now my baby's 2, and they grew out of it. Like, they didn't grow out of it, they probably grew into something else. Like right now, maybe they're dealing with constipation. Maybe there's some tantrums. Maybe they've had tons of ear infections. Yeah. Maybe they didn't crawl. Maybe they walked late. Maybe they're talking late. Maybe they have a lot of emotional dysregulation. Maybe a lot of emotional dysregulation. It's still a good time to get your kiddo in. Yep. So I just talked to a mom on the phone yesterday, called, and was scheduling her and her kid, and it was I don't know how old's the kid, 2. She's like, yeah, I just think they really need it. Honestly, they probably needed it when they were a baby. And I was like, yeah, you didn't know until you know. So I'm like, and it's great you're getting them in now. Yep, exactly. So that's not a good reason. Yeah. Okay. Hope we see you soon. Yep. Whoever you are out there. Whoever we're talking to. Have a great Wednesday. Happy Wednesday.